How can I effectively communicate with a dental lab when making a modelless crown?
The second question concerns communication when making modelless crown. We discussed the technique for achieving a good modelless crown scan during the main session. In this question, despite the scan data looking good, the processes ended up being high in occlusion. If there were no issues with processes when using conventional impression, but they suddenly do not fit after switching to an intraoral scan workflow, it can be quite embarrassing. Simply asking the technician to fabricate the prosthesis as if it won't occlude does not solve the problem. We need to identify the cause through communication and strive for continuous quality improvement through this process. Our clinic operates an in-house lab, but we also outsource some work to streamline our production. In the past, outsourcing a crown meant a week-long process. However, now with immediate data file transmission for scanning, remote labs can start process design in a timely manner. As a result, both in-house and outsourced production now takes just 3 days. So long as there is strong communication, outsourced labs are totally fine. What do you think of the quality of outsourced prosthetic at our clinic, Jane?
The quality has been great. The fit of the crown is almost perfect in most cases, and the shape matches well as if they were made right here in our clinic.
I agree. These outcomes reflect the collaborative effort over the past 5 years. Also, products have evolved from being imperfect when digital dentist was introduced at our clinic. This question was posted some time ago, and it sparked a heated discussion based on presented scan data. Opinions varied, with some attributing the issue to the lab skill, others to the scanning quality. However, the prevailing sentiment was that better prosthetic could be achieved if we switch labs. But in my experience, this rarely happens. I think that if the prosthetic do not fit well, a period of adaptation is crucial between the lab technician and the dentist. In our clinic, when a model's crown doesn't fit, we meticulously examine both the scan and the design file to pinpoint the issue. It means we need a system for quality control. Today, we have a video introducing our community system for this crown. Let's watch it together.
Our clinic introduced modelless crowns using the Medit i500 in 2019, which initially seemed highly innovative to me as it eliminated the need for a stone model. However, when I began treating patients with modelless crowns, I faced embarrassment because there were frequent misfits with the prosthetics. Not only was the scan quality not to my standard, but patients would also get upset because their prosthetics were not fitting properly. I found that I started to miss the old way. This was because with a stone model, I could easily diagnose fitting issues through physical trial, but with modelless crowns, since I received only the prosthetic, it was difficult to pinpoint the problems. To fix this situation, the director of the dental lab suggested taking another impression. He was sure that in doing so, I would be able to make well-fitting crowns, just like before. But I was opposed to this, emphasizing that we should adhere to the digital workflow. The dental laboratory adjusts the prosthesis based on an additional impression, ensuring it will fit right away. However, if at any point we stop providing additional impressions, the fit might be compromised again. Therefore, even amid challenges, solutions must be sought through digital methods rather than through analog ones. So what did I do? I decided to allow exactly 1 month for an adaptation period. At that time, I was still new to digital dentistry. I didn't even know there was a way to verify internal fitting using digital technology. So I insisted that 2 prosthetics be made for each case in different styles. Upon receiving both prostheses, I would deliver the one that fit better between A and B, and then provide feedback afterwards, informing the lab which one was better. After each delivery, I always documented the evaluation criteria. I kept all records in an Excel file where I evaluated and documented all cases, categorizing evaluations such as contact, margin, occlusion, shade, and fitting, and promptly sent them to the lab upon completion of delivery. As a result, around 1 month later, the prostheses suddenly started fitting well. I didn't know how this happened, but it was quite fascinating. All we did was simply give thorough feedback. This is what I learned during the 1-month adaptation period. 1. It is the wrong idea to hope that the modelless crown would fit well from the beginning without communication. Efforts for mutual communication are essential. 2. It is necessary to establish a system to enable active communication. 3. Simple A/B methods are clearly effective. However, in order to cut the workload, it would be better to utilize smart tools, taking advantage of digital technology. To summarize, what we need is a communication system and digitalized communication tools. Now let's consider building a communication system. As processes become more digital, we can obviously communicate more easily than ever before. When taking an impression, there is no way to indicate "this is where I think the margin is" on the impression body. However, the digital method can accurately convey the practitioner's intentions. There are many more ways to exchange opinions if we are willing to put in the effort, and it definitely helps achieve better results. For this to happen, it is important for the 3 entities, dentist, staff, and dental technician, to have assigned checkpoints. Let's visualize this in a flowchart. Here you can see everyone has a specific responsibility in the process of making a modelless crown. After each person completes their role, they check for any problems with their work before passing the task to the next person. Dentists must ensure the optimal environment is achieved after crown preparation and ask the staff to perform a scan. Staff should evaluate the scanning environment before starting, and, if it is not suitable, request for help from the dentist. Once the scan is complete, staff need to check the scan results and, if deemed perfect, forward them to the technician. The technician must evaluate the scan data immediately upon receiving the online request. If the scan data is insufficient, they should communicate this immediately and inform the clinic that it is difficult to proceed with making an accurate result. Let's look at a case that occurred at our clinic. During the process of manufacturing prosthetics through outsourcing, the staff obtained occlusal data incorrectly. If a prosthesis is manufactured in this state, the technician will have to arbitrarily predict the occlusion, which would lead to inaccurate results. However, the dental technician checked the scan data immediately after receiving the production order and immediately informed the clinic of the fact that there was an occlusion error through messenger chat. Of course, the clinic did not send the patient home, but had him return to his dental chair for a bite rescan as soon as Dr. Jiang received the message, so we were able to obtain accurate occlusion data. This example shows that immediate communication through a systematic process is very important. At our clinic, similar to the manufacturing industry, we handle modelless crowns by dividing the process into 3 key stages: before production, during production, and after production. Before production, we check the scan data in the lab and immediately set the margin position. During this process, the technician may encounter situations where it is difficult to determine which part is the correct margin. At this time, it is important to indicate the margin the technician thinks is correct and receive confirmation right away. At our clinic, we follow the principle of confirming the margin position of crowns treated on the same day through communication. It is more accurate and efficient for dentists to check immediately on the day of treatment because they remember the details better. After passing the first checkpoint, the crown design process begins. KED design process is an intermediate step in crown production. If setting margins was done on the day of treatment, this process will usually take place the next day. Conditions we need to check when designing a crown include contour, contact, and occlusion. By confirming the final design, we can request adjustments in contact tightness in advance. If the final design confirmation is performed routinely in this way, the dentist's opinion is always reflected in all crowns, reducing the likelihood of receiving a prosthesis with an undesirable appearance. Therefore, it makes perfect sense to have checkpoints through communication during production. The following is the post-production communication process carried out on the day of delivery. The dentist already has a clear prediction of the shape and color of the prosthesis that will be delivered to the patient, thanks to strong prior communication. If something differs from what was intended, it will be noticed right away. At this point, any discrepancies should be recorded and immediately communicated to the technician. Since the entire process took place within 3 days, immediate feedback helps the technician who implemented the design. For instance, if the occlusion is high, we might take a picture of the occlusion point and send it to identify the high point. This way, the same error will not occur next time by adjusting the occlusal settings in Medit or by the technician changing the settings in Design Program. Through this process, the patient received the correct prosthesis without any occlusal adjustments and was very satisfied. Chair time was significantly shortened, potentially saving us a lot of money. I believe all this resulted from good communication. Here's a tip I'd like to highlight for achieving a well-fitting modelless crown that follows the digitalized method. The internal value is checked in advance through software. This new method of communication can be implemented after crown fabrication is completed and before the patient comes to the clinic for delivery. Once the crown is fabricated, its inner surface can be scanned. Through this process, we can obtain data on the three-dimensional shape of the inner surface of the final crown and match it with the scan data used to produce the crown. By doing this, you can use the software to check which parts are different and by how much, as shown in the picture in the article. This way, you can visualize which part is not correct and immediately check and correct it. Although this method is accurate, in reality, it's difficult to inspect the crown every time using a program used in the paper. To make this process easier, Medit comes with software called Crown Fit. If your crown doesn't fit well, instead of getting frustrated with the dental laboratory, ask them to check the crown fit. Just like how we check the internal state of our body with an in-body after exercise and we receive a report, we receive a color-coded report indicating where things are wrong. We can immediately identify the cause, whether it is due to incorrect preparation, an inaccurate scan, or an error in the technician's internal fit setting. After going through this process for about 5 to 10 cases, the technician will be able to set the exact internal fit value that matches the dentist's preparation style. You can quickly learn the data through visual feedback without needing extensive conversations. For today's second question, we discussed the communication system and how to collaborate with the lab to produce accurate prosthetics. Moreover, if you communicate in this digitalized way, you will likely achieve good results more easily. I emphasize once again, if you first requested a modelless crown and it did not fit, do not immediately look for a new dental laboratory. You might end up endlessly searching for new labs. Instead, try working with your current lab to improve quality in just a few cases through the type of communication we introduced today. We are confident that you will receive a satisfactory modelless crown in a much shorter time. This answers question number 2.